When you think about surgery, you probably picture the big, dramatic moments, right? The first incision, the complex repair inside. But what about the very last step? Closing the wound. It might look like just a bit of sewing, but trust me, a single surgical stitch is a little masterpiece of science and skill, where every single choice is a big deal. And that's a much deeper question than you might think. See, a stitch isn't just about pulling two pieces of skin together. It's about creating the absolute perfect environment for the body to do its amazing work of healing itself. Exactly. It's this high-stakes balancing act. In a split second, a surgeon is thinking like an engineer, a biologist, and a craftsman all at once. They're weighing the tissue type, how much tension it's under, and how long that stitch needs to hold. Getting it right is everything. So, here's how we're going to break it all down. First, we'll cover why it's so much more than just a needle and thread. Then we'll get really specific and look at the point of the needle itself. After that, we're going to have a suture material showdown. You won't believe the options. Then we'll see some stitching techniques in action. And finally, we'll take a peek into the future with some pretty cool no-knot sutures. All right, first up, more than needle and thread. Let's get into why this isn't just basic sewing 101. Okay, section 2. We're talking about the point of the needle. Now, you might think, a needle's a needle, right? Well, in the world of surgery, the tip of that needle changes everything. At its core, it boils down to one fundamental choice for the surgeon. Do I need to gently spread the tissue apart, or do I need to slice right through it? That one question is the fork in the road, and it determines which type of needle they reach for. And you can see the difference right here. On the left, that taper needle has a smooth, round, cone-like point. But look at the cutting needle on the right. It's got a sharp, triangular tip. Those cross-sections tell the whole story of how differently they're going to behave once they touch tissue. So this design difference is all about the job at hand. Think of the taper needle like an awl. It finds a path between tissue fibers, gently stretching them apart. It's perfect for delicate stuff, like intestines or blood vessels, where you want to cause as little trauma as possible. The cutting needle, on the other hand, is like a tiny three-sided blade. It's designed to pass easily through tough, dense tissue like skin. It's all about picking the right tool for the right material. So now that we've got the needle figured out, let's talk about the other half of the equation, the thread. The suture material itself is a whole universe of options, and believe me, the choice here is just as critical. You know, surgeons kind of have this mental checklist they run through. First big question, does this stitch need to dissolve on its own, or should it stay there forever? That's absorbable versus non-absorbable. Second, is the material from a natural source, or was it cooked up in a lab? Natural versus synthetic. And finally, is it one single smooth strand, a monofilament, or is it woven together from lots of tiny threads, like a microscopic rope? That's monofilament versus braided. And this table gives you a great snapshot of how this all plays out. You've got chromic gut. It's natural, it's absorbable, but it also causes a pretty big inflammatory reaction from the body, so you'd only use it for something that needs to close up really fast. Now compare that to Prolene. It's a synthetic monofilament, and it's non-absorbable, meaning it's permanent. That makes it perfect for places with a lot of tension, like patching up a major blood vessel, where you need that strength to last a lifetime. Every single one has its place. And this quote really hits on that critical trade-off I mentioned. A surgeon always has to balance the physical properties of a material against how the patient's body is going to react to it. More inflammation can mean a bigger scar or a higher chance of infection. It's a constant calculation. Okay, so we've picked our needle, we've chosen our thread. Now it's time to put it all together. The technique, the actual path that needle takes as it weaves through the tissue, that's the final crucial piece of this surgical puzzle. And here it is, the granddaddy of them all. This is the simple stitch. It's the first one every surgeon learns. It goes in one side, out the other, you tie a knot, and you're done. It's straightforward, it's fast, and it works. The biggest pro, speed. You can close a wound really quickly with this, but there's a pretty big con. Each of those little stitch holes can act like a tiny doorway, letting bacteria from the skin travel down into the wound. That's why it's really best for wounds that aren't under a lot of tension. Now let's look at something a bit more advanced, the vertical mattress. Check out the path of this thread. It takes a deep bite far from the edge of the wound, then it comes back up and takes a shallow bite near the edge. This is why surgeons call it the far, far, near, near stitch. So why go through all that trouble? Well, this clever path does two incredible things at once. First, that deep, far, far loop pulls the underlying tissues together.
which takes tension off the skin itself. And second, the shallow near-near loop forces the very edges of the skin to pucker up and roll outwards just a little bit. That's called eversion. And as the wound heals, that little outward roll is the secret to getting a perfectly flat, barely there scar. It's all about that final cosmetic result.
For centuries, every single stitch has ended the same way, with a knot. It's just how it's done. But what if it didn't have to be? Let's look at a really cool innovation that's changing the game, especially in keyhole surgery.
Say hello to the barbed suture. The concept is so simple, it's brilliant. Imagine a suture that has tiny, one-way barbs running all along it. As you pull it through the tissue, the barbs catch and lock it in place. It's basically a surgical zip tie.
So here's the play-by-play. The surgeon passes the suture through the tissue like normal. As they pull it taut, those little barbs dig in and anchor themselves. The tension gets distributed perfectly evenly along the whole length of the wound. And the best part is right there at the end, no knots. This saves a ton of time and completely eliminates the risk of a knot failing or coming undone.
But of course, not all barbs are created equal. The first generation of these, on the left, had the barbs cut into the core of the suture. Now, that worked, but it also meant you were slightly weakening the thread itself. The newer tack on the right is way more clever. The barbs are molded right onto the surface of the suture. This means the core stays 100% intact, giving you all that tensile strength, making it tough enough for even deep, high-stress closures. So as you can see, that one little stitch is anything but simple. It's the end result of a whole cascade of decisions about physics, material science, and pure technique, all working together for one single goal: helping the body heal as perfectly as possible.
So I'll leave you with this thought. The next time you see a scar on yourself or someone else, maybe you'll see it a little differently. It's not just a mark. It's a testament to a hidden world of tiny, brilliant engineering decisions, a whole story told in a needle and thread, designed just to put us back together again.